There is no age limit for holding a CDL in the United States. That is a fact worth knowing, because a lot of experienced drivers assume the clock is running out on their career just because they are getting older. It is not. What does matter, every time, no exceptions, is whether you can pass a DOT physical that meets FMCSA standards. Age alone does not disqualify you. Your health picture does. And as drivers get older, that picture gets more complex. That is not a criticism, it is just biology. Here is what tends to come up more often as drivers age: cardiovascular conditions, high blood pressure, history of cardiac events, diabetes, especially insulin-treated diabetes, which has its own FMCSA exemption program but requires additional paperwork and monitoring, sleep apnea, which is more common as we age, and if you are diagnosed, you will need to show you are actually using your treatment, CPAP data reports, not just a prescription. Vision and hearing both get checked at every exam. You need at least 20/40 acuity in each eye, with or without correction. And you need to hear a whispered voice at 5 feet, with or without a hearing aid. Bring your glasses. Bring your hearing aids. You will be evaluated with them. Medications are another area where older drivers run into questions. The FMCSA does not publish a hard list of disqualifying drugs, but your examiner is required to evaluate whether anything you are taking could affect your alertness or judgment behind the wheel. Certain sleep aids, opioid pain relievers, some anti-seizure and psychiatric medications, these get a closer look. Bring a full medication list to your exam, including dosages and who prescribed them. And do not stop or adjust your medications before the appointment without talking to your treating physician first. That can be medically dangerous, and it does not help your exam results. If you have a condition that falls outside standard certification rules, exemption programs exist for vision, hearing, and diabetes, among others. These programs require documentation, a clean driving history, and specialist input. They also take time to process, so if you think you might need one, start well before your current medical certificate expires. The practical move here is simple. Go into your DOT physical organized. Bring your medical records, recent lab work, any specialist notes, and your sleep apnea compliance data if that applies. Know your blood pressure numbers. If they have been running high, work with your primary care provider to get them stable before your exam date. Experience behind the wheel counts for a lot. Keeping your paperwork and your health in order is how you stay in the seat.